My name is Dr. David Krasnow. I practiced optometry in Beverly Hills for 45 years. I have a history of COVID where I was hospitalized 2 years ago for 7 weeks. I went into respiratory failure and kidney failure. And where the doctors expected me to die, I didn't. I survived. I was only the third person in the world to have what's known as aortitis, which is an inflammation of the aorta. So when I was doing my research, I found the Stem Cell Center in Antigua and realized that they had a state-of-the-art center and their doctors are all board certified, highly qualified. So I made a phone call and sent all my medical records. I wanted all pre-op data so I could compare it to post-treatment. So I decided that it was time to get more aggressive with treatment for my variety of medical conditions, and that's why I sought out stem cell treatment. The conventional treatment that I had was taking lots of pills. I was on prednisone, I was on insulin, and I was taking 15 pills every morning. So I made my reservations and flew to Antigua. When I landed, I was met by one of their staff, the staff driver. He picked me up at the airport and drove me to a really nice hotel, Hodges Bay. Had excellent accommodations, good food, nice swimming pool, a beach. I was impressed. The first morning I was picked up at the hotel, driven to the clinic, and where my surprises started coming in rapid succession. It was a beautiful building. When I walked in, I was greeted by their staff. The place was immaculate. It was literally state-of-the-art, but state-of-the-art to the highest standard of the best U.S. clinics. They explained what they were going to do, and I was going to have a series of IV infusions. The treatment would take 4 days. There's no pain, it's just an IV, where a lot of treatments are 50 million stem cells. I had 200 million stem cell infusions. And they were talking to me the whole time, totally comfortable, not a problem at all. And they give you these fruit cocktails that are vitamin rich, so you get that after every infusion. It was delicious. When I came back home in Nevada, I noticed I had a little more energy. I went in for blood work and some more scans. And at the 3-month mark, the remarkable thing is that my glucose, which is a measure of diabetes, had been, my A1C was 8.4. And all that means is 8.4% is not a well-controlled diabetic. And about 3 months later, it was down to 7.1, which is rapidly heading towards normal. I noticed is that my breathing had improved. I could walk much greater distances post-treatment than pre-treatment. The other thing that surprised me was I went in and had more cardiac tests, cardiac enzymes, which are a measure of heart inflammation. And I had aortitis, inflammation of the aorta. And as of today, it's about 90% improved. I went in for a lung scan and found out that my lungs had improved markedly. I have way more energy now. I'm not sleeping 12 hours a day. I'm back to my normal 6 or 7 hours. And I attribute that to the stem cell treatment. I actually have hard data that the stem cells made a significant effect on my lungs, my heart, and all my blood work. It's an investment in my future. It's an investment in my overall health care. So I'm pretty excited to go back.